During this presentation, we will review the Medela ENFit products, which are part of our complete enteral feeding system, specifically tailored to meet the needs of neonatal and pediatric patients. They are designed to be secure, sterile at delivery, and meet regulatory recommendations, including the Joint Commission and Aspen standards. Medela ENFit enteral feeding tubes are available in a variety of sizes and material types. The feeding tubes are clearly marked with French sizes on the hub. Silicone and polyurethane feeding tubes have a maximum dwell time of 30 days. The polyurethane and silicone feeding tubes have side holes and an end hole that reduce residual buildup in the tip, the distal portion of the tube. The markings are intentionally placed on the orange stripe of the feeding tube in dark applique so the numbers stand out and are easy to read. Moving down towards the bottom of the tube, there are hand-drilled side holes which are very soft. I encourage you to run your fingers down the tube to feel how soft they are. The feeding tubes have a radiopaque tip at the distal end so they are visible on an X-ray to verify placement. The ENFit hub is built to be a locking connection. You can connect the feeding tube hub and extension set with just a quarter turn to make it secure and avoid a disconnection. Extension sets are available in two lengths, 60 and 70 inches. Macro priming volume is 2 milliliters and micro priming volume is 1.3 milliliters. In addition, we offer extension sets that feature a Y port for the delivery of medications. The extension set connects with the ENFit connector for a locking system to help minimize disconnections. ADA, Aspen, and Himbana provide recommendations to change extension sets and syringe every 4 hours. Follow your hospital protocol. The enteral feeding syringe with ENFit is available in 1 and 3 milliliter low-dose tip syringes and 5, 10, 30, and 60 milliliter in the standard tip sizes. The syringe is color-coded in orange for easy viewing when placed on a syringe pump. Enteral use only is written on the side of the barrel, along with a large, highly visible number scale making it easy to read. The Medela enteral feeding syringe is designed for enteral feeding. Notice the smooth pull of the plunger. This multifunctional syringe is designed to be used for gravity and pump feeds, as well as closed gravity feeding and venting. The 10, 30, and 60 milliliter syringes have been designed to accommodate the GraviFeed lid for gravity feeding. A snap-fit lid with hydrophobic filter is built within for venting. A non-vented cap for closing the syringe is included and allows for a secure fit for transportation or warming. The ENFit connectors create a locking system to help minimize disconnections. Connecting the ENFit syringe to the extension set requires only a quarter turn to securely connect, minimizing disconnections and misconnections. Connect using a quarter turn and turn until the connector feels snug or once you start to feel resistance, then stop. It is secure. You can pull on both ends of the connection and it will not release. When the feed is complete and you are disconnecting, be sure to hold the hard portion of the hub. To make a clean connection, we recommend the following process. The global design of the ENFit feeding tube hub can allow milk to overflow and dwell in the well of the hub. Dried milk can get into the moat, and it might be difficult to keep clean. There are cleaning products or brushes for sale to clean ENFit designs. However, these brushes tend to push dried milk around and not completely clean the moat. If cleaning is needed, use gauze or cotton tip applicators with sterile water and then dispose. When filling the syringe or extension set, fill to the top of the syringe barrel and not to the tip or hub. Leaving air at the tip will allow for an air-to-air connection. Air in the tip and air in the hub connection will prevent milk overflowing into the hub. To prevent leaking or contamination, avoid laying a full syringe down without a cap. Invert the feeding tube with every connection and disconnection. This change in practice will prevent milk from overflowing into the ENFit hub. Tailored to meet the unique needs of neonates and built for the demands of the NICU, because nowhere is the power of human milk more apparent than in the NICU. It's where drops save lives and small details matter.